Hi guys, welcome to what will hopefully be my last video in the RCHOP series that I have done throughout my RCHOP chemotherapy for non-Hodgkin's lymphoma. Just a very quick introduction. I have been diagnosed with follicular lymphoma many years ago, and have been on watch and wait maintenance therapy. And 6 months ago, I was told that my follicular lymphoma had transformed into the diffuse large B cell lymphoma. And I immediately was told to start what is called the gold standard chemotherapy for the diffuse large B cells lymphoma, and that is the RCHOP treatment. So without further ado, let me jump right into it. So I've had 6 sessions. This was the sixth session that I had about 10 days ago. And this is the final session of the RCHOP. And similar to the last two, pretty much the same routine. They start by doing the blood work, and they wait for the blood work to come back before they actually start the chemo treatment. They want to make sure that your blood counts are all pretty good and that you'll be able to tolerate the chemotherapy. They particularly look for people that are low in iron. So if your hemoglobin is low, or if your white blood cell or lymphocyte count is low, something that will raise a red flag. So in my case, all was well, and I was put into the infusion treatment room. Those of you that watched my video last time know already that there's a telehealth going on right now. So my doctor, my oncologist, is also doesn't physically come to the office because he is high risk, I think because of his age. So through Skype or something, we had the visit just by video. He asked the standard questions. I must admit that this is a bit, I'm not too happy is not the right emotion, but I mean, definitely I'm not satisfied. Let's say I'm a bit frustrated with this type of completely lack of interaction with the oncologist. One of the things that is very important during cancer treatment is to have a very open and honest conversation with your oncologist. Being able to ask questions to a live person and having an oncologist actually physically examine your lymph nodes, is very important. And throughout this COVID pandemic, while a lot of things I can completely understand and appreciate, this is one of them where I think the oncologist should be there physically to look at a cancer patient who is undergoing chemotherapy. And especially as it's my last treatment, I have really no other way of knowing whether it's working or not, except for talking to my oncologist and just drawing on his experience. And when you're doing these conversations through telehealth, it's really hard because the connection takes 5 minutes, and then by the time you can hear them and they can hear you, the time's up. It's very frustrating. That has been my experience with the telehealth. The other thing is similar to the last couple of times, no visitors are allowed, and my husband was not allowed to come with me. My husband comes every time to drop me off, even though I tell him that he doesn't need to. They won't let him in anyway. So again, it was a matter of doing this alone. This one I'm not complaining about at all. I completely get it. There's no need to add any extra risk factors especially for cancer patients. So I was given the treatment just like every other time. They start with the saline, the Benadryl. As always, I always ask for Ativan, which in my case really helps me with nausea. This has been my experience, and every time I take Ativan, I'm able to go through the chemotherapy without nausea during the treatment. The first time when I did this without Ativan, I was actually extremely nauseous throughout the treatment, and at one time even thought I was going to throw up. So anyway, those are the standards that I've been starting with. And then the CHOP part of our CHOP started. And I think I mentioned to you guys in the past The doxorubicin dosage was reduced slightly because I started to experience neuropathy, and my doctor has kept my doxorubicin at the slightly lower dosage. It's still not low, it's just very slightly lower to avoid the neuropathy side effects. And then the Rituxan is the final 90 minutes of the chemotherapy. Everything went fine during the treatment. I'm pretty used to these treatments. What I've started to do more and more, especially since my husband is not there with me, is during the treatments, I just do breathing exercises. I don't want to go so far as to call it meditation, because I don't want people thinking that I'm any kind of expert on meditation. I don't want to give any kind of false on that. But really what I'm doing is breathing exercises, and with that, I just try to focus on very positive thoughts while I'm going through treatment. And there is a lot of research done on this, and it's a little bit, it has to do a lot with really what you believe. And if you believe that breathing and positivity is going to help you during the actual infusion, then it will. If you don't believe that it will, then don't bother doing it. Do whatever works for you. If Netflix and or watching a comedy or sleeping, whatever it is that works for you, do that. I find that for myself, deep breathing and just positive thoughts is what has gotten me through chemotherapy, and that's what keeps me really focused and keeps me positive. One thing I did want to talk about that I haven't in my other videos is when they bring in the chemo drugs, you see them in these big bright orange bags, and they're all marked as biohazards, and they all have the skeleton and that kind of sign on them. I didn't want to mention it earlier on, but if you are at the point where I'm at towards the end, I'm not trying to scare anyone. Those things can be quite daunting. When you look at that, the nurses that do the infusion, they basically come out in like hazmat suits. And this is even without the COVID. So the chemotherapy drugs that they're putting inside you are, no joke, not to be taken lightly, very, very active chemotherapy drugs. They will have a very active reaction in your body. So it's not going to be easy. By levels will vary, but it will not be easy for anyone. And you do need to be mentally prepared for that. And a big reason why I do these breathing exercises during the chemotherapy is for that reason. I don't want to flip out or freak out at any point if I am feeling something different, or if there's a particular effect that kicks in. If I keep my breathing exercises and if I keep my breathing balanced, then I find that I can go through it without having to stop in the middle. And I really don't like to stop in the middle, because then you have to stop and they have to do all your vitals and everything all over again. And that's just not something that I'd want to have. I mean, there's no running away from getting chemo, so you may as well just start your session and finish it. So that's enough about the treatment. The day of the chemo, as usual, you're pretty conked out. There's so much fluids and so many drugs in your system. You're not feeling one way or the other. It's not a great feeling, but it's not a very bad feeling either, because you just have so much medication inside you that it masks any effects that the chemo could be doing. It's really the day after that the effects start to kick in. One thing I want to very, very quickly let you guys know is, in my case, this sixth time was the toughest out of all the chemo cycles that I've had. I was told before, actually, I researched that the effects of R-CHOP are cumulative, and you are likely to get through it easier, and it becomes harder as you go along, with the exception of the first cycle. In the first cycle, people typically have a reaction to Rituxan, and if you don't have a reaction to Rituxan and you're tolerating everything well, you should really be fine. By the sixth cycle, things start to get tougher. And when I say tougher, I mean the fatigue, definitely cumulatively, you feel less strong, you feel more tired. There's definitely a beating that your body takes more and more each time. Recovery from the chemo itself takes longer. So in the past, it would take me 3 to 4 days after the chemo to start feeling somewhat normal. In the sixth cycle, it's taken 10 days for me to even come close to feeling like somewhat normal. So this is 10 days after that I'm making this video because I haven't really been up for it. And I have other symptoms this time that I are more pronounced. I have absolutely no appetite. Nothing, no type of food, be it spicy, not spicy, any type of cuisine, be it any kind of, carbohydrates versus protein. I have zero appetite. I feel like eating nothing. I could go for days without eating anything, and I wouldn't even notice it. So at this point, what I'm really doing is number one is hydrate, 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 and so water and coconut water. This is my main form of hydration, and I am forcing myself to, forcing is a strong word. I'm basically having one good meal a day. I am having lots of fruits throughout the day, which is bananas, apples, pears, any kind of antioxidant fruits like raspberries, blueberries, and papayas. So having lots of fruits, and then I make sure that I have one very healthy meal. And in that very healthy meal, I will normally have things like avocado, beet, I'll have kale, or any leafy green that I could just steam and put some soy sauce, or any way that makes me just be able to eat it. I've been doing that, and I've been kind of adopting the Japanese method where I have the Japanese sushi rice, and I just put sesame seeds in it, and I steam a bunch of different vegetables, and I eat that, sort of like poke. And that has been working out well. That's the only way that my stomach can really handle it. Normally, when my family is having dinner or my husband is cooking, something spicy or a curry, I can't even be around the kitchen. I can't even be in the living room. If I smell that smell, it just drives me crazy. I mean, I get very nauseous basically. So whenever my husband cooks and whenever it's dinner time in our family, I normally leave the kitchen living room area. I lock myself up at the bed in the bedroom, and I turn on a fan so that I'm circulating all the smell out of the room. And I also the things that I've been using, I want to also show you. I've been using the peppermint oil. It's just an essential oil spray. This I just mist throughout the room, and this really helps with the nausea. I also have like a peppermint oil roll-on, and I just dab that on my wrist, and I keep, just doing that to smell it. And that really is what I've been using for nausea. My doctor did give me pills for nausea. I think it's the Zafran. I haven't taken it because whenever I take that, I actually get an upset stomach. So all these medications, the ones that you take for whatever reason you take it, then you're paying a price in some other side effects. So I've tried to avoid taking medications for side effects as much as possible, because I know they all come with something else, and then you have that other problem, and then you have to take something else for the other problem that it causes. So I've been using a lot of essential oils. I also breathe in eucalyptus while I sleep, and that really helps with just the congestion and things that also happen during chemotherapy. Another side effect that's been quite, I would say, pronounced after the cycle is mouth sores. And I don't remember really having this before, but now I have mouth sores from the chemotherapy. It's very, very common inside my mouth and also on my tongue. My tongue is almost like, when you bite into your tongue and you've then it hurts, and then whenever you have something very spicy, it kind of stings in that part. It's like that kind of a feeling. So anything I put on my tongue that is even remotely spicy just burns, and it really stings, and I can't tolerate it. So I just have to keep drinking cold water or cold coconut water after eating anything that is even remotely spicy. And spicy is not just spicy as in chili spicy, even like things that are high in acid. So I made a salad for myself the other day with balsamic vinaigrette, and that turned out to be something I couldn't tolerate. I made a sandwich and I put Dijon mustard, and I couldn't tolerate because of the spiciness. So, very, very high sensitivity to the types of food. Another thing that I want to mention is if you are undergoing chemotherapy, the overall healing, because chemotherapy slows down cell generation, that's how it actually works, is that it slows down the cell generation process. Chemotherapy targets cancer cells from not regenerating as fast. So what also happens is your healing slows down. So if you get any kind of cuts and bruises, which I have, they say chemotherapy also makes you more clumsy, and you tend to bump into things and spill things. And I don't know how much truth there is. I've not statistically studied it, but whenever I've bumped into something or I've hurt myself in any way, that wound will stay. If there is a cut, it will just take forever to heal. Typically, if you get a cut, by the next day, it's already starting to heal. Now, if I'm on chemotherapy, that cut will basically stay there for a week or longer. I got a bit of a bump in my head at the back. I don't even know how that happened. I bumped my head, and for 2 weeks I was just hurting, and I couldn't sleep because every time I would lie down on it, it would hurt, and it would give me it was actually hurting when I lay down, and it gave me a headache. You can't take much medication during chemotherapy. No Advil, Motrin, anything, only Tylenol. So even with that, I'm very careful. So just to say that, just be careful. Of course, things will still happen, but healing is a slow process when you're on chemotherapy. And then the last topic that I would like to talk about is the mental side of it. And this becomes more and more important as you go through chemotherapy. It's so hard, there's so many highs and lows, and more lows than highs when you're going through chemotherapy. It's very, very difficult to keep yourself positive. It's very hard to sort of keep positive because you don't know. You really don't know whether the treatment is going to work, and that has been my biggest cause for anxiety. Is if I knew that I have to go through something and it's going to be a really, really crappy ride, and it's going to be terrible for 6 months, and I'm going to be miserable, but at the end of 6 months I will be cured. That is something to hold on to, and you can really kind of get through things by knowing that, okay, 6 months and you're done. What happens with cancer is you go through the 6 months of really rough 6 months of brutal side effects, and then you're waiting for the scan, and there are enough people that treatment doesn't work for, and then they have to go to salvage treatments, and they have to go to secondary treatments, which are even harder. So I think that is really the hardest part for me, is that possibility that I've gone through all this, and when I get my PET scan, it's going to show that there may have been some reduction, or some overall reduction of the cancer burden, but not enough. And that's a really big fear that I have. So 6 weeks after the last chemo is when they are going to do my PET scan. So it's still a month away. And then I will find out. So, I don't want to say all is great. I didn't get to ring any bell at the end of chemotherapy. You kind of see that in some movies where they showed that at the last chemotherapy session, the patient is ringing a bell. I didn't ring any bells. No one even offered it. I probably wouldn't ring any bell anyway, because it's not like you're out of the woods, and I also feel that it's a bit insensitive to other cancer patients who may be in a worse situation than you. So there's no joy in cancer, right? So let's not pretend. I understand that every little small thing should be appreciated and one should be grateful, but I don't think it needs to be so like vocal, and you don't have to like be jumping up in joy that you finished your thing, because it's your body, and it's for you to know and your family to know. So anyway, that's where I'm at. Again, yet another long video. I'm really sorry, guys. But those of you that watch it, I know that you are liking the amount of details that I put in these videos. So I'm hoping that you are appreciating this video as well. My husband has suggested that I should make shorter videos on very targeted topics, and I will do that next. But for now, this is me signing off, and I will make another video after I get my results. Please keep your fingers crossed for me, guys, and pray for me. And I hope that I'll make a video with good news, but if it's not the best news, I will get through it, and knowing that your prayers are with me will really help. Thank you so very much for watching, and ciao.